and don't have any other children. So we thought that we would put together some information for you to help you to make the choice that you need for you and what's right for your baby. One of the things that I wanted to cover today, since all of you are either about to have your babies or just had your babies, talking about the immunization schedule from ages 0 to 6 months. And hopefully by the end of the presentation, you will be able to gather the information and make a choice for you and the baby. The first thing let's do, I have the PowerPoint here, and it says immunization 0 to 6 months. First thing we want to do, of course, is educate ourselves. So I'm going to focus you in on the PowerPoint, and I'm going to go over some things with you. This is the CDC's recommended immunizations from birth through 6 years old. But as I said, we're going to talk about the ones that cover from birth to 6 months. So at birth, it shows that the recommended vaccination is the hepatitis B. And that's actually something they will give pretty much immediately after birth in the hospital, unless you specify that you don't want them to do that. In a minute, after we talk about the schedule, we'll talk about what each one of these vaccines do and why they're important. The other vaccine at 1 to 2 months is the hepatitis B again, and then the rotavirus, the DTaP is what that's called, which is diphtheria, tetanus, and pertussis. The Hib vaccine, which is the hemophilius, oh, I always get that wrong. I'm sorry. The Haemophilus influenza type B is what the Hib vaccine stands for. And then the other one is the pneumococcal virus. And finally would be your IPV, which is the polio vaccine. These are all given at different schedules. As you see here, it's the 2 months, the 4 months, and the 6 months. And I'm going to give you all, most of you I see have already picked up a copy of this as you came in. And if you'll turn over on the back as we go over these, it will also give you an explanation of what each of these cover and why they're important. So let's watch a quick video that might answer some of the questions that are on your minds already about these vaccines before we go over what each one of them are.
CDC TV presents Get the Picture, Childhood Immunization.
Like you, I'm a parent. Like you, keeping my child safe is my #1 priority. I'm in a Mom's Morning Out group, and we had all sorts of questions regarding vaccines. I decided the next time our Mom's Morning Out group met, I would invite a pediatrician who's a friend of a friend. Ladies, this is Jeannie Santoli from the CDC. She came to answer some of our tough questions about vaccines. Jeannie, thank you so much for coming.
Well, thank you very much for asking me. I really enjoy talking with people about immunizations. I'm also a mom and a pediatrician, so this is a great opportunity, and I appreciate coming.
Did you vaccinate your own children?
I did. I have 2, and they're both fully vaccinated.
So what's Anna up to nowadays?
I just took her to get her 9-month-old shots. We were a couple of weeks late. And, you know,
okay.
I know, but it's so hard. I took her in. But, you know, I was watching something on TV about, somebody was talking about how vaccines cause autism. I mean, do vaccines really cause autism? Well, you know, autism is a very serious disease. It's heart-wrenching for families, and I think one problem is that we don't know very much about the causes of autism. There have been a number of studies that have looked at the link between autism and vaccines, either the measles, mumps, rubella vaccine, or thimerosal, that's a preservative that was in a number of childhood vaccines up to 2002. And in fact, those studies don't show any link between vaccines and autism.
You know, I feel like, especially maybe it's because I have 3 kids, but I feel like I'm always going to the doctor to get shots. And so sometimes I just worry that we're getting too many shots. Is that really a concern? Is that a problem?
You know, it's an important question because now we have probably about twice as many vaccines to protect children as we did, say, 20 years ago. So even though children do get vaccines against about 14 different diseases now when they're quite young, that's not more than the body can handle. A child puts a toy in their mouth or crawls on the floor, and their immune system sees those germs, recognizes them, and teaches the body how to protect itself against them. Vaccines work in that way, and they help children's bodies recognize germs that can cause very serious diseases.
I have another question that's sort of related. I mean, I understand why we have to have the number of vaccines, but how about the schedule that the doctors follow? Is it really appropriate for every child?
Even though there's only one childhood immunization schedule, it actually takes into account the differences between children depending on their health or medical conditions. Sometimes parents ask about delaying the vaccines in the schedule, and I think it's really important for parents to understand that that can place their children at risk for getting these serious diseases.
What happens if we stop vaccinating? Do these diseases really come back?
The diseases absolutely will come back if we stop vaccinating. We've seen that over the past couple of years with outbreaks of mumps and measles. There was a story of a little girl who was from Indiana. She and her family went and traveled to another country. She wasn't vaccinated. She came back with measles to the United States. And because of her, she was in contact with more than 30 people who developed measles. 3 of those people had to be hospitalized, and 1 even went to the intensive care unit.
I get really nervous about taking my daughter to the doctor to get shots because there's something that I can do to comfort her while, you know, she's getting her shots.
Well, I mean, it is hard to take your baby for shots. I know I feel that way when I take my little ones for shots, but you can hold them and cuddle them while they're getting the vaccine, and then you can hold them tightly afterwards. And actually what I found was that nursing the baby right afterwards often makes them feel comforted pretty quickly.
Jeannie, thank you so much for coming today. You've answered so many of our questions. If you have any additional questions, ask your pediatrician.
I've been a pediatrician now in private practice for about 22 years and see between 25 and 40 patients per day. I spend a lot of time talking to parents about the importance of vaccines. We used to see 5, 10, 15 cases of invasive Hib disease, including meningitis, in this practice a year. And it was just so devastating to the parents because they had really just kind of gotten to know their babies by that point and knew their personalities, and these babies would sometimes die or be maimed for life. Since the inception of that vaccine about 20 years ago, we have not seen a single case of invasive Hib disease. Moms and dads ask me every day, should I immunize my baby? And I answer every time, absolutely yes. It's one of the most important things you can do to protect your baby's health.
A message from the U.S. Department of Health and Human Services.
So, in this video, they answered some of the common questions, and I'm sure you might have more. And at the end of our presentation, if there's anything that they didn't cover and you have some questions, we're going to have a question and answer time where you have the opportunity to present some of your questions or concerns, and maybe we can give you some answers to help you make the decision that you need to make for your child. So the first vaccination that we're going to talk about is the hepatitis B vaccine. The hepatitis B vaccine protects against hepatitis B, and it's spread through body fluids and blood. When a patient or a child has this illness, there may be no symptoms at all for quite some time. But then there's also the possibility of a fever, headache, weakness, vomiting, jaundice, which is a yellowing of the skin and eyes, or joint pain. And over a long term with this, you can end up with chronic liver infection or liver failure or even liver cancer, which of course, as we know, eventually will cause death. The next vaccine that we'll talk about is the rotavirus, or the RV. The rotavirus protects against rotavirus. And how is this spread? It's spread through the mouth. The most common symptoms for rotavirus is diarrhea, fever, and vomiting. And the biggest complication you're going to see with this disease is going to be severe diarrhea causing dehydration, which we know in young people, especially infants, can very easily lead to life-threatening illness and hospitalization. Next is going to be the DTaP. The DTaP is the diphtheria, tetanus, and pertussis. The first one is the diphtheria. Symptoms of diphtheria are sore throat, mild fever, weakness, swollen glands in the neck. It's spread through direct contact and in the air, which is very difficult to avoid. Common complications with diphtheria is blisters, bleeding disorders, encephalitis or swelling in the brain, and pneumonia. The other one is tetanus. Most of you have probably heard about that when you get a cut or something like that. And the symptoms of tetanus would be stiffness in the neck, abdominal muscles, difficulty swallowing, muscle spasms, and fever. Now tetanus, it's, like I said, exposed usually through exposure through cuts and so forth in the skin that you can get on different surfaces. That's where it lives. And the long-term complications of this would be broken bones, breathing difficulty, and eventually death. Finally is pertussis. We've heard a lot about this in the news lately because it has come back with a vengeance. That was a disease that you really didn't hear much about, and now you hear quite a bit about it. The way that this is spread is through the air and direct contact. And common symptoms are severe coughing, runny nose, and apnea, where there's a pause in breathing. And the biggest complication you'll see, which would be death, but also a pneumonia or infection of the lungs. And it can cause some long-term scar tissue and other issues later in life. So then let's look at this slide. Is showing us some examples. This here is diphtheria, and it's a very mild case actually. And if you'll notice, the arrows are pointing to the back of the throat. It's pointing out, it's called a pseudomembrane. It looks like mucus or something there. And what it does is this grows and it covers, eventually will cover the tongue and can block off the opening of the throat there and so forth and become very large and obstruct the airway. This here is an infant with tetanus, and as you see the stiffening of the neck and the body, and they're so rigid, that is what tetanus actually does to the muscles and causing damage and so forth. This is pertussis, and like I said, being that you all have either just had children or pregnant, you've probably even been taught to by your physician, your obstetrician, about getting vaccinated yourself if you haven't been, and also making sure those who are going to be around your baby are, because it has come back. And this is just a short video that shows one parent's story. If you'll notice, he's not breathing.
Okay. I know.
So if you'll notice the coughing and so forth. But the other thing that's very interesting about this story is the parents had to actually present the idea that their child had pertussis. And I'm not sure how old this video is, but that's one of the common things about vaccinations, and how when the illnesses are no longer as common, people tend to stop vaccinating. And that's how pertussis has come back, not just from not vaccinating, but people who travel and so forth, bringing it back to our areas. And because we are so used to being vaccinated and assuming that it's no longer around, sometimes physicians need to know that your child was possibly exposed to that, or reminded that that could be what it is. Now, pertussis right now is a very hot topic, so most physicians will test for that. But a lot of these other illnesses, like the question at the beginning about should I immunize, what happens if we don't? We never see these things anymore. And the reality is that they are still there, but because of immunizations, we don't hear about them much because we have been immunized. So the next one that we're going to cover is the Haemophilus influenza type B, or the Hib vaccine. And what this type B influenza does is it spreads through the air and through direct contact. And with this one, there may be no symptoms whatsoever until it enters your bloodstream, which then turns into what's called septicemia, which can cause meningitis, intellectual disabilities, epiglottis, which is a closing of the epiglottis or your throat area, pneumonia, or death. The child here that's depicted as you see this swollen area here, and this is caused from the Haemophilus influenza type B. And this child here has necrotic tissue because of the damage to the blood and so forth into that area. It's a cellulitis type that then has led to the necrotic tissue. Next is the pneumococcal vaccine. And it too is spread through the air and direct contact, and it too has no symptoms. But it also can cause pneumonia, or an infection of the lungs. And one of the direct complications with that would be bacteremia, which is an infection of the blood, meningitis, which is the infection spreading to the brain and the spinal cord, and then eventually death. Polio. This is one that we tend to feel like, no one gets polio anymore. It's just not an issue. And again, why is it not an issue? Because of vaccinating the community and making sure that those vaccines are done regularly. We don't see that much in our country, but it does still exist. Polio is spread through the air again, direct contact, and through the mouth. And it too can have no symptoms, but then also it can have sore throat, fever, nausea, headache, and some of the complications is paralysis and death. And with polio, a lot of people don't realize that even if you have no symptoms, there have been people that I've taken care of myself that had polio but had no symptoms when they were younger, but then later ended up with what's called polio syndrome, which is also a debilitating illness that affects multiple areas of the body and causes weakness and difficulty functioning and so forth, and can also be life-threatening. So this slide I added to help to explain why it's still important for us to get vaccinated. The first one here, as it says on this side, no one's immunized, but only 2 people are ill. But because no one is immunized, what happens is the disease or contagion spreads to nearly everyone, and only a few do not get sick. Pretty much everyone gets sick. Then in this one down here, a few of them are immunized, but most are not. And as you see, there's just 2 in this whole group that are ill. Well, after time, that illness passes through most of the population, and only a few remain untouched. And that would be those few that were immunized and just a few that were not. This one down here, most of the population is immunized. There's a couple that are not, but most are. And then you put the illness there and you still end up with most people not being affected by the spread of the vaccination. And this is the main reason why vaccinations are important. If you are the one who chooses not to immunize, then as you see, the illnesses are still there. And your child might be the one who ends up catching that illness because they were not vaccinated. And here's this video is just a quick review of the changes and the vaccines that you would get through the different stages of life for the children. And if you'll notice here in this little box, it has the vaccinations that you would want to get at this stage. And this I didn't give to everyone. It is in the back as you leave out. It's a little booklet that you can have to keep the history of your vaccinations and maybe make some notes on it about your child.
For parents, there's no greater joy than watching your child grow up happy and healthy.
And so long before Parker ever walked on his own, we were taking steps to help make sure he'd be healthy for life. We knew there'd be boo-boos, bumps, and bad dreams.
We also knew a little love could go a long way, and that we would need a lot of help along the way.
Some of that help came from Parker's doctor. As first-time parents, we worked together with Parker's doctor to do everything possible to keep him healthy. We had so many questions about his development and care.
And protecting Parker from serious diseases was our priority. According to our doctor, that included getting him vaccinated and sticking to the schedule that the CDC sets. Our doctor told us that the American Academy of Pediatrics and the American Academy of Family Physicians also approved the recommended immunization schedule.
Seeing that so many medical professionals were on board made us feel more comfortable following the schedule to protect him from everything from hepatitis B to polio.
And knowing he was protected gave us something to smile about.
Especially since when we took him back for his shots at 4 months, the nurse helped us understand that we were giving Parker the best protection there is from 14 serious diseases before he turns 2 years old. I'll admit we were feeling a little anxious about his shots, but the nurse also explained that we could comfort him by holding him during his shots and swaddling or feeding him right after. So we felt better knowing we could help him feel better.
Thankfully, each time we took him to the doctor, it got a little easier on all of us, and just understanding we were protecting him made us feel better.
Even more so after we heard that kids in the US still get some of these diseases, like whooping cough and measles.
That sounded a little scary, but our doctor reassured us that the immunization schedule is designed the way it is to provide babies protection early in life, before they are likely exposed to life-threatening illnesses. So by keeping Parker on schedule, we were giving him the best possible protection. We also learned that to give Parker that protection, we needed to make sure he got every recommended dose of each vaccine.
And after all the research we did, we learned about some of the diseases that vaccines prevent that we hadn't heard of before we had Parker. Like, we didn't know that Hib and pneumococcal disease could cause pneumonia and meningitis.
Even though he's bigger and stronger now that he's a year old, it's still important to stay on CDC's vaccination schedule. He'll need a few more shots before he enters kindergarten, but in the meantime, he'll be protected against serious diseases like measles, mumps.
Is filled with happy, healthy memories. Immunization, power to protect. For more information about vaccination, visit cdc.gov/vaccines or call 1-800-CDC-INFO.
So, we now have covered the basics and what immunization, why it's important, what immunizations you need, and so you've gotten that information. So now step 2, decide what is best for your child, vaccinate or decline. What I've put up here is 2 separate forms. This form here is a refusal to vaccinate, and it's a recommendation by the American Academy of Pediatrics. And the reason that most physicians will give this if you choose not to vaccinate is because there is some important things that you need to know. Not only do they want you to understand what the vaccines are and why they're important, but they also want you to be sure that you know that if you choose not to vaccinate your child, it is extremely important that when your child is ill, anytime you have an issue with medically for your child, that you make sure that you inform the personnel that your child is not up to date on vaccinations. And the reason for that is because then when they're trying to diagnose the child based on symptoms, that will help them to realize that they need to look at a variety of possibilities, not just what would be excluded if they had been vaccinated. So that's what this side is. This one over here is called a vaccine information statement. And what it is it has all of the first vaccines that we've talked about on here. And it explains most of the information we've talked about, just kind of a little more brief, on what each vaccine is, what the signs and symptoms are, and why it's important. Now, all of you have this already as I gave it to you when you were coming in, and our hope is that by the time you leave here, we can guarantee that you would be willing to sign this to go ahead and initiate your vaccines for your baby. And this finally is what we're going to give you as you exit, which is an immunization schedule. And on this, it has, like I said, from birth to 6 months, it has what vaccines will be given. And then down here, it has just a little thing that you can put for the checkups with their growth and development and how they're doing, and you can add some things in yourself and so forth. So now, I'm going to close this out, and we're going to turn this over to a question and answer session if any of you have that. One other thing that I wanted to point out to you on this PowerPoint slide and the paperwork we're going to give you is it gives some sites where you can go and research information if you'd like, such as the CDC, American Academy, Family of Physicians, and the American Academy of Pediatrics, and there's also even more. The Coalition for Immunizations. These are some good websites. These are some good websites for you all to go to and refer to, and when you're looking up information, the main thing that we encourage is that you make sure that your information is credible. Just like you would not go to your mechanic to get medical information. You wouldn't want to go to certain websites that are not knowledgeable and have the medical background that they need to give you any type of information. So I'm going to close this out and stand up and just give you guys an opportunity to ask me any questions.